Mark, thank you. Turning now to the coronavirus in Connecticut, many people who get COVID-19 will recover. Channel 3's Caitlin Duclos spoke with a doctor about what that process of healing is like.
Well, recovering from COVID-19 can be a long road, and to talk more about what's needed to make people feel better, we are joined by Dr. Subramani Seetharama, who is the medical director at the Hospital of Central Connecticut Spine Center. Thank you for being with us.
Thank you for having me.
Talk to us about how you're caring for patients who are recovering from COVID-19. What does that process look like?
So, a good question. So, Hartford Healthcare is a COVID-safe environment right now. And we can provide care for patients through the continuum of care, which means inpatient. If you're an active COVID patient, we isolate you. Our therapists are provided with PPE, and they will manage you. We want to figure out what your impairments are. Depending on how severe your illness is, you might have cognitive deficits, you might have physical and psychological deficits. If you are of a mild or moderate illness, you might be doing well, except for some fatigue and shortness of breath. So when you get discharged, we are able to manage your rehabilitation, whether you go home, whether you go to a rehab program, or whether you go to a subacute rehab facility. And in all these facilities, we are providing you care in your room if you want it, but we also have virtual health if we need to. We educate you, we keep you working physically, cognitively, and psychologically. That is the whole point.
So as you mentioned, the treatment and the symptoms that people have from COVID really do vary from person to person. So does that mean that the therapy changes as well from one patient to another?
Absolutely. So if you have just a mild shortness of breath and fatigue, you need some physical therapy and respiratory exercises. So you need to see a physical therapist. Now, you take a patient who is elderly, who's from a nursing home where the effect of COVID-19 has been devastating. These are folks with underlying anxiety, depression, and dementia. So they have a lot of cognitive deficits where speech therapy and our geriatric colleagues work together to provide them with specialized, more intense therapy.
Good information, Doctor. Thank you so much for being with us. We appreciate it.
Thank you for having me.